Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Tracy, treatments for cancer, as you well know, actually, things like radiation, chemotherapy can wreak havoc on patients. You like wreak or wreck?
I'll go with wreak.
Okay, wreak havoc on patients. And it's not easy, being treated for cancer. And I can actually attest to that fact. My wife, having just gone through treatment for breast cancer, there were some tough times. The chemotherapy, the radiation, none of it's easy.
No.
And you had both, too,
Yes.
didn't you?
Common side effects of treatments can include nausea, vomiting, fatigue, and weight loss, and they can make getting proper nutrition difficult and challenging.
In an effort to improve the lives of cancer patients, leading cancer centers in the United States, including the Mayo Clinic, have formed the Cancer Nutrition Consortium. Through research and collaboration with health, industry, and culinary experts, the Cancer Nutrition Consortium offers recipes and resources for those undergoing cancer treatment.
Here to discuss is Mayo Clinic gastroenterologist Dr. Paul Limburg and Terre McJoynt, a Mayo Clinic operations administrator and a member of the Cancer Nutrition Consortium's board of directors. Welcome to you both.
Thank you.
Dr. Limburg, Terre McJoynt, so nice to have you with us. So, proper nutrition for patients undergoing cancer treatment can certainly be a challenge.
I can say that 29 years ago when I was diagnosed, this was not part of our discussion. So that must be something that we've learned over the years. Dr. Limburg?
Yeah, well, thanks for the opportunity to talk about this important topic. I do think that it is something that we are paying more attention to these days. As our cancer therapies hopefully have gotten better, they're more effective, they're hopefully more tolerable to our patients, then we can focus on some of these other equally important areas to try to improve not only their quality of life, but their overall health as well. So focusing on nutrition, making sure that people can be healthy while they're undergoing these necessary treatments is really the goal of all of the things that we do in that nutrition space, and also with activity, stress resilience, all those different areas.
Terry, what is it that got you involved in this consortium, this Cancer Nutrition Consortium?
I was a member of the Mayo Clinic Cancer Center some years ago, and I had worked on another project with Dr. Bruce Moskowitz, who founded this effort. And he reached out, along with other premier medical centers, to come together to develop a research study so that we had data to create a response and really understand the needs of our cancer patients.
What is it? What are the issues when you're undergoing either chemotherapy or radiation? What makes it difficult for a patient to eat?
What I hear from my patients, Tom, is that even foods that they previously might have enjoyed are different during the time of chemotherapy or radiation therapy. So foods may not smell the same, foods may not taste the same, foods may not be appetizing like they were prior to this life-changing event and the treatments that go along with it. So what we wanted to learn with Terry's help and with the wonderful organizations we had a chance to partner with is how can we actually ask the right questions for these patients who need a different approach to nutrition so that we can meet their needs in a better way.
It seems like that this has obviously been a problem ever since chemotherapy came on the scene what's it been, 50 years ago? Probably pretty close to 50 years ago. But I think in some ways the problem has gotten a little bit better because you're better able to control the nausea and the vomiting. I can remember back in the early days when methotrexate was the treatment for kids with osteosarcoma, bone cancer. They were in the hospital. They could never do this as an outpatient, and they vomited continuously. Extremely difficult problem. Still have the same problem, but not to the same scale, right? It's in some ways it's better.
Yeah, I think definitely the drugs have changed, the tolerance and the effectiveness have changed, and again, back to now we can focus on these things that otherwise we maybe just didn't pay enough attention to in prior days.
How important do you think good nutrition is to helping the patient actually fight the cancer?
I think there are benefits to nutrition that we're only beginning to understand, and I think particularly in this population where not only are we trying to control or eliminate the cancer, but also make sure that people can maximize their ability to experience effective life-saving drugs, it just makes the issue so much more important.
Which is the bigger culprit in general, the chemotherapy or the radiation?
I'm not sure that anybody would have the same answer. From my standpoint, I would like to look at the person more holistically. So the disease process and the treatment, and how can we individualize the nutrition needs for that person.
Well, what is it that you've learned that you need to change or address when it comes to cancer patients? What has the consortium figured out?
So I'll let Terry add in her comments as well, but I do think that understanding that people who are receiving chemotherapy, radiation therapy, cancer treatment have different needs than the general population. That is something that maybe we just don't give enough recognition to. So how can we make sure that we've got the right texture, the right odor or lack of, so that somebody doesn't smell a food and not want to even eat it. Coffee is a very powerful, has a very strong scent to it, and some people may like that. Some people might be totally turned off from that. So we want to make sure that we can individualize for that person whatever it is that they want, food and beverages that can help them maintain their nutrition status.
I remember, for myself, it was a long time ago, but I remember the mouth sores being a huge problem. But probably a bigger problem for me was the list of foods that I could not eat because they would have an effect on the medication that I was taking. That has to be something that plays into what the consortium will end up recommending.
What the consortium found through this study is that about 84% of the patients experience fatigue, and then mentioning mouth sores, we know that over 12% experience that. So it really affects what you put into your body or what you choose not to eat at all. What we found is that people that experience fatigue were making their own meals, and so they didn't have the energy to wait for a meal to be cooked, and so they went without. So further inducing the fatigue. So then what happens? They don't have the energy to attend an event or a family function, and they become isolated. So what we hope is that improving nutrition will improve their experience, their life quality, so that they can stay engaged in family events and in the community.
I suspect that there are different levels of nutritional inadequacy based on the kind of treatment and the cancer involved, right? I mean, so let's say you had cancer of the pancreas and you're getting chemotherapy and you're getting radiation to your abdominal wall. Nutritional issues would be greater for someone like that as opposed to a lymphoma patient where the chemotherapy is much more benign.
That's right, and I think we have the pleasure of working with our expert colleagues across Mayo Clinic to understand the medical side of the nutritional needs of the patient, as well as the social elements that Terry was mentioning in terms of, I just don't feel good enough to make any kind of meal, whatever it is that I should be eating.
Is there a way that you can objectively measure whether or not the patient's nutrition is adequate?
There are equations that I probably learned in medical school but don't have at my fingertips anymore.
Look, please don't ask me.
To think through what's the basal metabolic rate, what are the nutritional needs for somebody that's undergoing the stress of a disease and also a treatment, and our dietitians, our nutrition experts can figure out, based on all of those different parameters, not only how many calories should an individual take in, but what should those calories be composed of, with respect to, sugars and proteins and fats and all of those different elements.
Nutrition for cancer patients. We are with Mayo Clinic gastroenterologist Dr. Paul Limburg and operations administrator and a member of the Cancer Nutrition Consortium's Board of Directors, Terry McJoynt. Time for a short break, but we got a myth or matter of fact when we come back.
That's right. Myth or matter of fact, all patients undergoing cancer treatment should be taking vitamins and supplements.
You're listening to Mayo Clinic Radio on the Mayo Clinic News Network. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
We are talking about cancer nutrition with a member of the Board of Directors of the Cancer Nutrition Consortium, Ms. Terry McJoynt, and also gastroenterologist Dr. Paul Limburg. Time for myth or matter of fact.
All right, here we go. Myth or matter of fact, all patients undergoing cancer treatments should be taking vitamins and supplements. Dr. Limburg, are you going to take that one?
I'd be happy to, Tracy. So I do think that there are advantages to some vitamins and supplements, but I don't think all patients necessarily need to follow that approach. The best advice we could give our patients is to make sure that your clinicians, your physician and care team are aware of what you're taking. So please don't be afraid to tell us about what supplements you may or may not be using, because they can have positive effects, but they may also interact with some of the other medications that we're prescribing.
Do you ever remember recommending to a patient that they take a multivitamin or take a specific supplement?
Absolutely. And I spend a lot of my career trying to prevent cancer as well, Tom. And in that context, there are some very powerful, potent supplements, vitamins that seem to have cancer preventive effects. So I think in the right context, there may be different uses for vitamins and supplements than there may be in the chemotherapy, radiation therapy patient.
Now, wait a minute. I want to follow up on that. He said that maybe there was something that we could take to prevent cancer. Is that what I heard you say? And what should we be taking?
So there's a field of science called chemoprevention, which deals with how can we prevent the disease before it becomes invasive. Cells in the body become abnormal, sometimes for triggers that we can understand, like cigarette smoking, sometimes for reasons that we haven't figured out yet.
Sure.
But there are things like vitamin D, selenium, calcium in some studies have been shown to reduce the incidence of various types of cancers, at least in animal models, and there are some human data to support those preventive potential effects anyway. At this point, there's not a blanket recommendation to take vitamins and supplements to prevent cancer, but we're working on it.
All right, that's what I needed to know, because you don't take any.
I
No, I didn't mean to put words in your mouth. Do you
No,
take any?
I don't take vitamins and supplements to prevent cancer.
Okay, got it.
All right. Terry, tell us who is involved in the Cancer Nutrition Consortium, because that's what we want to learn more about.
Thanks, Tracy. Yeah, this was actually an initiative by Dr. Bruce Moskowitz. He's the founder of the effort, and he really struggled with his patients that were undergoing chemotherapy and radiation therapy with nutrition. And so he reached out to 7 of the world's leading cancer centers to see if we could come together to conduct a research study to develop some measures to help these patients.
So what about that study? What did the research find?
The research included over 1,200 people. We understand that the largest factor of cancer treatment is significant fatigue. Next is constipation, poor appetite, reflux, indigestion. It's a myriad of symptoms that really affect the quality of life for our patients. Dr. Moskowitz spearheaded this effort through the Bruce Moskowitz and Bruce and Marcia Moskowitz Foundation. It includes participation from the New York University Cancer Center, Dana-Farber, the Sidney Kimmel Comprehensive Cancer Center at Johns Hopkins, the University of Chicago, of course, Mayo Clinic Cancer Center, and Cedars-Sinai, along with Roswell Park. So a large group of world-leading cancer centers. Jeremy Jacobs, who happens to be the chairman and CEO of Delaware North, who's also the owner of the Boston Bruins, provided a portion of support through the food service. He supports through the hospitality service.
So through this effort, did you come up with just recommendations, or there's recipes, right?
Over 200 recipes on the website, and then our partnership with Hormel was a great success. We have over-the-counter meals that are very convenient for patients. You can actually have them at room temperature, which makes it easy for patients that have multiple appointments or they're traveling, and then shakes and some other products online.
But
You said over-the-counter meal, sorry. You mean you go to the store, what do you look for that says, you're a cancer patient, this is what you ought to be eating?
It's Vital Cuisine, and you
Vital,
can get them
okay.
online today. I think there's 5, and the next stage of our project is to focus on pediatric and geriatric patients. So there'll be more specific meals coming for those particular groups.
And now I'm such a junkie for recipes. Did you say that there's recipes online so you can actually go and find recipes that are great for cancer patients?
Yes, and these recipes were developed by master chefs from the Culinary Institute in New York, and they are phenomenal. I enjoy them. They have I'm just going to share this, they have a chocolate pudding that's made with avocado, and it tastes just like chocolate pudding. It's phenomenal. Some of their
But the reason why it's good then is because it's sneaky because you're getting nutrition in with the chocolate pudding.
Yes, and you don't even know it.
That's good.
Yeah, you don't taste the avocado. You just taste the pudding.
Well,
Yeah,
I love
how can you beat that?
avocado, but having more nutritious chocolate pudding, I'm always on board with that.
Exactly. Yep. So these recipes, master chefs, and you've got 200 recipes, and you mentioned that they're on your website, but we've got to know, where's your website?
The website is cancernutrition.org.
So what's next for this Cancer Nutrition Consortium? Do you have more work yet to do?
It is. We really want to become a solid resource for cancer patients. And so our website is a great resource for patients to ask questions, get answers. What we found early on is that there were either lacking information for nutrition or conflicting information. So we brought all that together as a solid resource for our patients. And our next step, we're hoping to develop future studies in geriatric and pediatric patients, and then develop recipes specifically for those age groups.
When you asked the master chefs to come up with some recipes, what were the guidelines that you gave them? What did you say you really wanted?
Well, we, as Dr. Limburg mentioned, some of our patients react to strong aroma. So we had to develop recipes that had low aroma, were quick to make. In the recipes, we wanted to make at least 4 servings at a time, and they had a limit of 7 ingredients, and it had to be easily achieved, purchased ingredients.
Okay, so nothing too outlandish.
Correct.
You didn't have to go to a fancy grocery store in order to find the ingredients.
No, we didn't
Readily
want that.
available.
We wanted simple ingredients that
Sure.
were easy to make. We found that over 53% of our patients were creating the meals themselves. And the other 20% was a spouse or a family member.
Dr. Limburg, has this been available for you to be working with patients? Have you been able to use this as you help treat patients?
It has, and I think this is a tremendous resource, and I think it will continue to grow, as Terry pointed out. You know, sometimes the simple things have the biggest impact, and so being able to allow cancer patients to live a more normal life, not only to take better care of their health, but to just do the things that they wanted to do, would like to continue to do even while they're undergoing treatment, like preparing a meal or at least sharing a meal with family members and friends. I think it can't be overemphasized. So just want to say thank you to Terry for making the connection for our cancer center, and also to all of the supporters who have participated in this study.
Terry, wonderful work. So tell us what's next for the Cancer Nutrition Consortium.
We're going to continue to grow the website so that we keep up to date with new practices, question logs, so that we can stay up to date with that. Also recipes with our master chefs, and focusing on our pediatric patients and our geriatric patients in the future.
A couple of things that you mentioned that I want to make sure our listeners hear, and that is there are over-the-counter meals available for patients who are undergoing cancer treatment, and they are called Vital Cuisine, correct? And your website is cancernutrition.org.
Correct.
All right, Mayo Clinic gastroenterologist Dr. Paul Limburg, and member of the board of directors of the Cancer Nutrition Consortium, Terry McJoynt. Thanks so much for being with us, both of you.